Hi, in this video we're going to be reviewing the shoulder and in general just the anatomy of the shoulder, what some things that you can think about as you're moving in your shoulder joint, as well as helping to keep it healthy, and maybe some key points if you are feeling some shoulder pain, what you can do about it to help reduce that pain as quickly as possible. So when we think of the shoulder, it's essentially made up of three bones, okay? The top bone across here, this is a right shoulder by the way, okay? The top bone here is your clavicle or collarbone, then your arm bone or the humerus, and then your scapula or the shoulder blade. And what I thought was interesting when I was first learning anatomy, that the shoulder blade is actually much bigger than you think. Sometimes you just think of this bone back, like the little wing bone in the back, but it actually not only is the wing bone in the back, but this bone that comes across, the spine of the scapula comes across and becomes the top of the shoulder joint here. And that's called the acromion. So when you think of the shoulder, sometimes you might only think of, or the shoulder blade, you might think of just the back. So notice that it does make this top lip of the bone here. When this clavicle comes across here and the acromion is here, this is the AC joint. So right here is that AC joint that maybe you've heard about before, and sometimes that can get injured or sprained. Oftentimes, weightlifters can have some aggravation to that joint just depending on their form and technique they've been doing over the years, as well as falling on your shoulder in sports or just falling in general. You can aggravate that area. Now, when we think of the ball and socket, the humerus here, I brought the skeleton here so you could see as well. When we think about the humerus, this long bone here, it's a ball and socket joint into the shoulder, right? The important thing on this is understanding this little, when you think of the ball and you think of the socket is really shallow. So unlike a hip, which we have a very deep socket, the shoulder is more shallow. So you might have heard of like a golf ball on a tee is kind of how the shoulder is. Now, what lives in the socket part is called the labrum. There's a little piece of cartilage that kind of outlines the socket, and it's like a little piece of squid or calamari feel, right? So there's this little extra piece of cartilage that outlines the socket so the ball can sit a little bit better into a socket feel to give it some stability, okay? So the labrum lives inside here, as well as there's bursa that live in here. There's just fluid-filled sacs that go between this bone area and the tendons that are going to be coming through here to help reduce the friction between the bone and tendon. So they just kind of help serve a purpose of creating some space and reduce friction. But with that said, sometimes due to faulty mechanics, due to muscle weakness, due to poor postural habits, we can start to aggravate what lives underneath here, like the bursa, and you get a bursitis in your shoulder, as well as the tendons that live underneath this space, which then we can end up with tendonitis. And then if we really aggravate them, especially after 40, we start to wear and tear the tendons more. We can start to end up with tearing of the tendons. And you, of course, have heard of tearing of the rotator cuff tendons. So what lives in this space underneath this acromion, or part of the shoulder blade, you can see here, is tendons, and four of which are the supraspinatus tendon, which is the top one here. You have two rotator cuff tendons back here, as well as infraspinatus and teres minor, and then the one in the front, which I'll show you on here, it's right in here, and it comes and attaches to the shoulder, is your subscapularis. So those are the four rotator cuff muscles that any one of those, but in particular the supraspinatus is probably the most common, can start to have tears. And we probably all after the age of 40 have tears in our tendons, but we're not symptomatic until they become more symptomatic, obviously, or become a full-blown full tear versus maybe just a partial tear. We call that like a full thickness tear. You can start to have more pain. But with that, when we think of this space, what I wanted to bring up was the importance of the shoulder blade positioning, okay? So when we think of the shoulder blade in general, you can see how it just is along this rib cage. It's a floating bone. So really there's no attachment of the shoulder blade into the rib cage, except for when we come around to the front and we see the shoulder. So if I show you this shoulder on this side, you can see there's lots of ligaments as well as tendons that are connecting the ball into the socket. And that's where we have the stability of the shoulder. So the shoulder blade itself, if we have faulty posture and our breastbone has dropped, which is really common as we get older, and even as being younger too, with faulty positions and postures, we're on our phones more, we're text messaging, we're looking at our internet, whatever we're doing, and we're in this poor positioning, or even on the computer in a poor positioning, the breastbone is going to drop down. Well, when the breastbone drops down, the scapula kind of follows. It's floating on the rib cage. So if our breastbone drops down, the rib cage comes forward like that, and our scapula is going to then tilt up, and it drops this bone down. So if that bone is dropped down, well, what does it do to that space between this bone and the top bone? It decreases. So if we have less space, right, then what happens to those structures in there? The bursa and the tendon that live in that spot are going to be more pinched. And when we have pinching, that means more friction when we go and do movements, and when there's more friction, there's more wear and tear, hence we get a bursitis, hence we get tendinitis, hence we get tears in our tendons. So we want to really think about posture. So we really want that upright position. So in another video, we'll really talk about positioning and posture and how to best find the posture. But for now, just notice if our breastbone is down, it's going to cause our bone to tilt down in our shoulder and pinch more. So we need our breastbone to be lifted. And the other thing is when we move our arm and do things like overhead lifting or reaching to get something into a cabinet or your luggage and you're trying to put in the overhead bin, we want to position our thumbs to be up, okay? Oftentimes we're like this, right? Our thumbs are down and our elbows are high. Well, when we think about it, if you can see on this ball and socket, I'll even bring it in closer, the ball has this extra piece of bone. It's hard to see with this little attachment here, the ligament, or the tendon here, but if you think about this area, there's a little lip of bone. So with this little lip of bone, right, then it's not a beautiful ball. So it's not like this just rotates like a beautiful ball like our hip socket does. There's that little lip of bone. So this bone, if we are turned inward, okay, if our elbow goes higher than our wrist, that's inward rotation. This bone gets closer to this bone, right? So we could be upright, but we could still pinch our shoulder because our elbow is high. So like washing windows, reaching for things, we want to make sure that our thumbs are up. So what that does is it creates a little more movement of this little extra lip of bone, right? If we think of the ball and socket, it kind of helps to clear the joint. So the little lip falls under and we can go all the way up. You can even do this at home. Put your palms down, take your arms overhead and see what that feels like in your shoulder, right? Notice you kind of feel like an end range. It feels a little pinchy. Come back down. Turn your palms up. Go all the way overhead. You can go all the way up because you're kind of touching your cheekbones because the ball now has positioned better. That little lip is not touching or pinching at the top bone, okay? So anytime we're working overhead, or I should say over 90 degrees, if we're right out in front of us, this is fine. Thumbs can be up or down, you're okay. As soon as you start to go beyond 90 degrees, this is when we have to make sure our thumbs are up, elbows are down, whatever it is that we're doing, washing windows, doing things that we're trying to keep that ball in a better position. Okay, so there's two things that we talked about so far that can make the space smaller. One is posture. If we're slouched and trying to move our arm, the bones are closer together. The other is if our elbow is high and we're trying to move our arm, the bones are together. Now, put those together, poor posture with the arm up, it's even worse, right? So we want to make sure we have good positioning. So oftentimes the other area of the shoulder that gets aggravated is the biceps tendon. The biceps tendon is on here. You probably see the groove a little bit better on this bone. It's right in the front. So when we think of our humerus just falling straight down, there's this little piece right here, right? There's a groove that the biceps tendon goes through and lives. That's one of the tendons. We think of biceps, it's 2 bi, meaning one goes into the joint, or there's 2 tendons. One goes into the joint, one comes across and attaches at this part of the bone of the shoulder. So we have 2 tendons. This is the long head of the biceps, which is more problematic most of the time. And it goes in and inserts into the labrum, which then inserts into the socket. So when we think of positioning and mechanics as well, we can also aggravate this long head of biceps tendon with poor, faulty mechanics, okay? So to keep your shoulder healthy, we want good, healthy posture. We want to think about how is our arm bone positioned. So we don't want elbows up, we want thumbs up, elbows are in. And we also want to do some exercises that are specific for this joint. So if you've heard of rotator cuff exercises, some of which are you have a band and you're pulling the band and say it's attached to the door. And we'll show you this in another segment, but you'll be pulling the band out and back in. These are really important to do. You could be lying on your side and lifting the arm up and down. There's different ones that are important to do before you go and do a workout. So if you're one of those that go to the gym and do lat pulls and bench press and do these bigger movements, you're going to want to train those little tiny guys to help keep that ball in the socket. The rotator cuff muscles are what steer that ball in the socket. So if they're weak and our pec, our delt, our lat takes over, they're going to overpower these little guys, and then the ball will start kind of moving in different areas rather than stay nice in the socket as you do all your movements. So I hope that was helpful on the shoulder. Just think about that, especially if you're doing chores around the house, if you're pulling weeds, washing windows, washing your car, but also if you're at the gym doing incline presses and overhead presses, right? There's oftentimes I'm seeing people with their thumbs in towards each other, doing overhead or incline or even raises. We really want to be mindful that the thumb is up. So whenever you're going to do an overhead press, you can start here, but as you go overhead, you really want those thumbs to be up and back. You don't want to be pressing this direction. You might feel like it feels more, but all you're doing is you're compressing more, so that's why it feels like you're doing more, right? So as you go overhead, turn those thumbs back, come back down. Turn those thumbs back, come back down. Whenever you're just going to do an overhead press, just have your dumbbells here. Do the overhead press like so. Not at max external rotation and with the thumbs going inward, right? So just kind of keep that in mind. You don't want to have this like open position where you're overhead and pinching. Just have those thumbs go back a little bit. It doesn't have to be all the way in front of you. Just turn them a little bit so they're just not so turned in up here at the top. Okay? All right, I hope that was helpful, and we look forward to seeing you in the next segment.